Coming up next on Moms Every Day, we'll find out more about hormone replacement therapy and why it's not just for women who are postmenopause. Stay tuned. Today on Moms Every Day, we are in Sherman at the office of Dr. Deanne Strobel talking about hormone replacement therapy. I think there's a lot of misnomers when it comes to this, a lot of confusion. So let's begin with, who is a candidate for this?
Well, I think one of the misunderstandings is that it's just for menopause women. So a lot of people think that you will not need hormone therapy unless you've gone through menopause. So that is very incorrect, because a lot of women start having symptoms about 15 years before they go to menopause. So it's patients with fatigue, trouble sleeping, weight gain, things like that. Those are the first symptoms. Even joint pain sometimes can be an initial symptom.
And I will say, I was looking at your website. There is a list of symptoms. You don't have to meet all of them, but if you have maybe 5 or 6 of them, you could be a candidate for this.
That's exactly right. And we do testing to make sure that the person is having problems from a hormonal imbalance.
Okay, tell us what hormone replacement therapy actually is.
Well, nowadays, we really use more of something called bioidentical hormone replacement therapy. So that means trying to balance the hormones in a way that you feel better and seem more like yourself again.
Okay.
So it's not necessarily the old synthetic tablets that a lot of people associate with hormone replacement.
Okay, and this is prescription. It's not a supplement that you can get
correct.
at a health food store.
That's right.
But talking about some of the symptoms that you mentioned, and when you know that you're a candidate for it, do some women not recognize it because it's just been a gradual thing over a number of years? Is that one of the challenges?
That's exactly right. A lot of women think it's just that they're feeling down because they are stressed or overworked or depressed even. A lot of people are put on depression medications to treat their symptoms before they actually end up seeing me or getting checked for bioidentical hormone use.
So when a woman comes into you, how do you find the correct balance, what her body needs?
Well, we start by doing a really in-depth interview, so I want to know all of the symptoms. Some people, the symptom is hair loss or irregular menstrual cycles. So it's not necessarily menopause. There's a lot of symptoms that can occur to suggest it. So we do a thorough interview, and then we do blood work. So the blood work depends on the symptoms. I have to know what symptoms the person is having, so I'll know what appropriate blood work to draw. And then interpretation of the labs is very different, because what the lab says is normal range, it does not necessarily mean it's an optimal range for that person. So it takes a lot of interpretation.
All right, valuable information, but we have to wrap it up there. Thank you. I'm Ellen Sacco. Be sure to check our website, momseveryday.com/Texoma.